What medications should you and your family store to make sure you are ready for whatever may come? Hi, I'm Jonathan.
And Kylene Jones, and we are the Provident Preppers. A well-stocked home pharmacy can be a lifesaver if you have a child who develops a sudden fever, contract a nasty cold, or get a debilitating headache. What would you do if you were unable to go to the store and get the medications that you need to take care of your family?
In this video, we'll talk about 15 over-the-counter medications that we keep in our home pharmacy and that you may want to consider. We'll also talk about the importance of storage conditions, and we'll talk about prescription medications and some specialty medications you may want to consider. Your Prepper Home Pharmacy is an important part of your emergency preparedness and storage program. This video is based on the post Prepper Home Pharmacy, the best medications to stockpile.
And to start off, we have a disclaimer. We are not doctors and we are not giving medical advice.
We encourage you to consult with your medical providers before taking any medication.
The information that we share with you are the meds that we stock in our home pharmacy. We do use many home remedies, but that is a discussion that is beyond the scope of this video.
Your home pharmacy may be different than ours, and that's okay. You're going to design this for your specific needs.
It is important that you consider the unique needs of your family members when designing your home pharmacy. Are there any allergies or sensitivities to medications? Do you have infants or young children that may need special formulations of medicines? How about special needs due to a chronic medical condition? Does someone have seasonal allergies? And are there any issues with pain management? If you have someone in your home that has substance abuse issues, you will need to take special steps to ensure that the medications are safely tucked away from that person.
The ideal storage conditions for your medications are cool, dry, dark, and in the original packaging.
The actual shelf life of a medication will be different than the best if used by shelf date that is printed on your bottle. The medical letter states many drugs stored under reasonable conditions retain 90% of their potency for at least 5 years after the expiration date on the label, and sometimes much longer. We should expect a gradual loss in potency over time. If the appearance or color of the pills have not changed, the medication is likely safe to consume. The storage temperature and packaging will significantly affect the actual shelf life. Liquid preparations are not as stable as tablets or capsules and will generally have a shorter usable shelf life.
So just how much of these medications do you need to store?
When it comes to storing medications for an emergency, it's just not possible to come up with a one-size-fits-all answer. We recommend that you consider your worst-case scenario and calculate the amount of medication you might be required to take care of your potential needs, and then store a little bit extra, just in case you need to share. And while many medications are good well after the expiration date, it's best to keep a fresh supply. It is reasonable to stock enough over-the-counter medication to last a year or two. Prescription medications are much more difficult to obtain, and you may be lucky to get a 1 or 2 month backup supply.
We're going to discuss our top 15 over-the-counter medications that we stock in our home pharmacy.
Ibuprofen is effective in treating both pain and inflammation. It is commonly used to relieve headaches, earaches, sore throats, sinus pain, muscle strains, menstrual cramps, arthritis pain, and back pain. It is also an effective fever reducer. Ibuprofen can also be used in combination with Acetaminophen. Together, they are highly effective at relieving severe pain. Our son recently had his wisdom tooth removed and opted to control the pain with ibuprofen and Acetaminophen. I was surprised at how well it actually worked. Naproxen is a non-steroidal anti-inflammatory drug. It's effective at relieving pain, fever, inflammation, similar to ibuprofen. But the unique thing about Naproxen is that it will last for 12 hours. We stock Naproxen because some of our family members prefer it.
Aspirin is another effective pain reliever. It also controls fever and inflammation and can be used as a blood thinner, which helps to prevent strokes and heart attacks.
Acetaminophen is the only over-the-counter pain reliever that is not an anti-inflammatory drug. It doesn't irritate the stomach like Ibuprofen, Aspirin, or Naproxen.
Diphenhydramine is an inexpensive antihistamine. It is very good at controlling allergy symptoms, respiratory infection, hives, nausea, anxiety, and sometimes even insomnia.
It is important to have a non-addictive sleep aid during difficult times, and this is one that will work well for some people.
Loperamide is used to control diarrhea and intestinal cramping.
Diarrhea can quickly lead to dehydration, which makes this medication a really good choice to keep in stock. Polyethylene glycol is an osmotic laxative and is used as a stool softener and for the relief of constipation. The stress and dietary changes resulting from a disaster often result in stomach and bowel issues. MiraLAX may take several days to work. Glycerin suppositories are a great way to relieve constipation within just a matter of minutes.
Pseudoephedrine is effective at temporarily relieving congestion in the upper and lower respiratory tracts. It is helpful in relieving symptoms associated with the common cold, flu, hay fever, allergies, and bronchitis.
While pseudoephedrine is an over-the-counter medication, it is highly regulated. You will have to go to the pharmacist and ask for it, present your ID. They will run your name through a computer system to make sure that you are not stocking up on this medication. It is an ingredient used in the manufacturing of methamphetamines, and that is why it is so highly regulated. If you want to stock up on this, you will need to do it over time and gradually increase your supply.
Fexofenadine is often used in combination with pseudoephedrine to be an effective allergy medication.
Any medication that has pseudoephedrine in it will need to be purchased at the pharmacy. But this is a good option to have on hand for both allergies and to relieve cold symptoms.
Meclizine is effective at controlling nausea, vomiting, dizziness, and motion sickness.
It's also helpful for some people who suffer from anxiety and insomnia. While Meclizine is not a controlled substance, you may need to ask the pharmacist because we have found that frequently it is stored behind the pharmacist's counter.
Ranitidine is used for the treatment of heartburn, ulcers, reflux, and sometimes hives.
Hydrocortisone cream comes in handy for treating inflamed or itchy rashes such as eczema, poison ivy, diaper rash, and genital irritations.
Bacitracin is an effective first aid ointment that's used to treat abrasions, lacerations, insect bites, and sometimes stings. It will not be effective for fungus or viral infections, but it can be used to treat superficial bacterial skin infections. Clotrimazole is effective at treating fungus infections and yeast infections and ringworm.
And finally, meconazole nitrate for the treatment of female yeast infections.
Now that we've talked about over-the-counter medications, let's talk a little bit about prescription medications.
If you have a chronic condition that is managed through prescription medications, it is really important that you stock up on your prescription med. Sometimes that can be really challenging, so we have a few ideas. First off, it is always important to explain to your medical provider your concern and work with him or her to come up with the best solution for you. Doctors are frequently given samples of medication from drug companies. If they provide you with a few samples, make sure that you keep refilling your prescription on schedule, and you can easily get a backup supply of 30 to 60 days this way. Insurance companies will usually refill your prescription every 25 days. If you faithfully pick up your new prescription at 25 days, by the end of the year, you will have a 60-day backup supply of your critical medications. One other option is to ask your physician for another prescription which you will take to the pharmacy and pay cash. The insurance company dictates how often they will pay to refill that prescription. So if your physician is willing to give you an additional prescription that you pay cash for, that will enable you to build your supply. Medical providers will not give you any type of controlled substance for emergency preparedness. Controlled substances are drugs that cause mental or physical dependence. Don't even bother asking. We're talking about refilling the medications for chronic conditions such as high blood pressure, diabetes, asthma, and heart disease.
You may also want to include specialty drugs for specific risks. For example, if you are concerned about the possibility of pandemic, you may want to stock an antiviral. These antivirals typically include Tamiflu and Relenza. If you are interested in using Tamiflu or Relenza, we encourage you to visit with your healthcare provider to weigh the costs and the benefits that you may receive or may not receive.
Both Tamiflu and Relenza require a prescription in order to obtain them.
For more information about evaluating your risks, we encourage you to look at Prepper Risk Assessment. What threats should you be prepared to survive? If you're concerned about a nuclear event, you should probably store potassium iodide. This substance prevents the thyroid from absorbing radiation.
You may want to consider storing a few antibiotics in your emergency stash. The decision to store antibiotics should be carefully thought through. Antibiotics can only be legally used under the direction of a licensed healthcare provider. Antibiotics will not treat a viral infection, but they can save lives. We encourage you not to use antibiotics except under the direction of a qualified healthcare provider. The antibiotics you stockpile are for use when competent medical care is not available and you do not have any other safe options available to you. Antibiotics have side effects that need to be carefully weighed before taking. The safest source for obtaining antibiotics is from your healthcare provider.
Cynthia Cochler, a doctor and the author of Armageddon Medicine, lists her top 3 antibiotics to store for crisis situations. These are cephalexin, ciprofloxacin, and metronidazole. These 3 antibiotics will cover 90% of the bacterial infections you may encounter. While these are her recommendations, you should talk to your healthcare provider to see what is going to be best for your family.
The perfect prepper home pharmacy to me means that I don't have to rush out to the store to get whatever I need to take care of a sick family member.
And there may be times when it simply won't be safe for you to be out and about.
The perfect prepper home pharmacy starts with a perfectly designed plan for you and your family. Get started on it today, and remember that those medications need to be in your home, not at the pharmacy.
We encourage you to look at these other resources that may be very useful to you. Prepare Now to Survive a Pandemic, Shelf Life of Vitamin Supplements in a Survival Food Supply, and 12 Ways to Prepare to Survive an Economic Collapse. You can find links to these in our show notes. We encourage you to take a look at them, and we also encourage you to look at our website, theprovidentprepper.org, for a massive amount of information on a whole variety of topics. Creating your home pharmacy is a wise step in your preparedness efforts. We encourage you to take stock of what you have on hand, throw away the stuff that's bad, and stock up on the things that you may need to take care of your family.
And now for the question of the day. What medications do you stock in your home pharmacy? And what challenges have you come across stocking up on medications so that you are ready when disaster strikes? Comment below. And thanks for being part of the solution.